Hello friends, good evening. Myself Dr. Deepan Patel, CEO, founder, Aalayam Rehab Care. I really hope you all are doing good and safe during this pandemic period of COVID-19. As you all know that this period is taking so long in India, even in Nairobi. But we decided to make this period a more productive period because we strongly feel that our patients are our top priority. Previously I had done so many Facebook live in our local language, it's an Indian language, but this time and we got the out of imagination, we got the tremendous response. So today my Facebook live session is particularly for the Nairobi, Kenya, and it's really great to do this all thing in English and try to help you guys because what is going on right now. There are a number of people in this pandemic staying at home during the due to the lockdown. They are suffering from the different kind of the pain. It's kind of a neck pain, back pain, frozen shoulder, sciatica, and osteoarthritis. So our goal is we are starting our new branch in Nairobi. So our goal is to help you guys know about what we are, how we are doing, how we are working, how our 4D technology work. Friends, I have done my Master of Education in Kinesiology from USA. Here is the thing, so many people doesn't know what is a kinesiology, what is a kinesiologist doctors do. So I'll try to explain you. Whatever the movement we do, it's a basically a muscular movement. So the kinesiology is a motion, science of the motion. So like when we get up in the morning and when we go for a bed, we do a lot of activity, like we stand for a long time, we lift the weight, we sit on a chair, then we stay the climb. So that time particularly the muscle works, that muscles are identified by the kinesiologists. So most of the kinesiologists work in a sports industries. Like sports people are getting so much injured on the field. So their main role is to identify where is the weakness in a muscle, how we can strengthen this muscle and solve the problem. So let me share something about all of you. Before 6 months I came to Nairobi for a visit, one of my family friends. Nairobi is one of the wonderful place I have visited, though I visited so many countries, but I really like the culture and the weather of Nairobi, where I met so many people, which also includes some of an Indian community. They are very fabulous. I must say that they were so much welcoming and generous. I really appreciate their hospitality. But when I met so many people, I talked to them and I came to know they are suffering from different kind of the pain, like as I mentioned earlier, it's a sciatica, frozen shoulder, knee pain, ankle pain, but they are not getting a proper solution. So and they are not getting a proper treatment. So when I introduced the technology we use, it's a cold laser and nanocurrent technology. So people over there love the concept, but and they were amazed because as you can see, we are working in 20 cities in India, and we have more than 160 doctors team working with us. So they were very surprised, and they all are eager to get this kind of treatment. But the main thing was a traveling to the India. I know it's a lot of mess for you guys staying in Nairobi, because obviously you have a businesses, job, your kids. So it's difficult to come India for a treatment. So the things sort up in my mind, why don't we come to the Nairobi and help you guys? So now I love to share with all of you that our doctors are available in Nairobi, Kenya, and you can contact Aalayam Rehab Care Kenya for an appointment. So as I said earlier, I have done many sessions of Facebook, though, but not in English. But today we are trying to explain you everything in English, so it's easier for you guys. At your home you can understand everything. We are using the we always said we are doing the cinematic 4D medical. So my goal is to help you guys to understand all of the things, like how the knee osteoarthritis happen, how the sciatica happens. So today's my session, you know, like Facebook Live, my goal is to help you guys to understand how the musculoskeletal pain happens. Though it is a vast topic, but today we are going to discuss on a knee and back. Hope you guys enjoy the session. So now we start our Facebook Live, how the problem happens. So here is a thing. Anything when we are getting a pain, it's a inflammation. I would say inflammation is what? Inflammation is we say you can see the part. It's a pain like warm, redness, temperature. So so our goal is to help you understand how the pain happens, how the swelling happens when we have any kind of injury. You can figure it out when any kind of injury. The thing happen is it's a pain. So pain is, it's a beginning procedure. So pain, it's a beginning procedure. So how it happens, why it happens, we try to figure it out. You can see here pain has a following symptoms. It's a warm, so you can see the temperature is a little bit higher up. You can see the swelling, you can see the redness. That is a classical sign of the inflammation. Friends, when you have any kind of injury, when you have any kind of a degeneration, it's a beginning, it's a inflammation. Keep in mind. So these four are the signs of the inflammation. Now our goal is to help you understand how it works, you know, like, so first thing we are going to take it's a knee joint. So like majorly we are getting problems in a knee joint. So knee is, it's a most weight bearing joint of our body. So when we get up, when we walk, our whole body weight goes in the knee. So most of the time what it happens when you get up from a bed, when you climb the stair, you know, like your weight is weight goes in a knee. So that is the reason major people in the world are suffering from the knee pain, and it's a research been done in the US that because of the lifestyle we are getting osteoarthritis, we are getting a knee pain. And the research saw almost 60 to 70% people whose age is more than 50, they have probability of the knee osteoarthritis or a knee pain. So we try to understand how it happens, why it happens. So try to figure it out, the thing, you know, like when we get up, you can see here how the process work, you know. So the process is working like that. So basically when we get up from a bed, our body weight goes on a knee joint. So there is a meniscus in between two knee joint. Here you can see, so there is a meniscus in between the knee joint. And once the age you know, like aging process, this cartilage degenerated, you can see here, this is called loss of the cartilage. So loss of the cartilage is called osteoarthritis. Friends, one thing most important, it is a process, it is not a one day thing. So when you get up in the morning, you don't have a pain on the previous day, and the doctor said you have a bad knee, you have a damaged knee, or you have osteoarthritis, you need a surgery. No, it is not like that. It is a process, it is a periodically process. So our goal is to, you know, like try to understand how it happens and how we can prevent it. The main thing is each and every person doesn't require a surgery. So my goal is try to you know, like help you guys understand how it happens and why it happens. So first go to the knee joint, so it's easy for us to understand how it working. So here is a thing, you can see here, this is this is basic our knee joint, and on the bottom of that there is a very thin layer called articular cartilage, and it's a very thin layer. It is, we can say, just 0.73 millimeter. So what happening is, when we get up from a bed, when we stair climb, what happened, the weight pass from two joint, and because of that the weight goes from your knee joint like that. So in between these two joint, this is called a meniscus. Here is a thing, here is a main thing, this is a meniscus. So when this damage, you have osteoarthritis. Most important thing, how it happens and why it happens. Let's try to figure it out, why it happens and how it happens. This is our main bone, this is called a femur. This is a main bone of our body, and it is surrounded by the muscle like that. So what happened, this is our main muscle. When this muscle become weak, the main role of this muscle is to do a motion like what, motion like when we walk, when we get up from a bed, when we stair climb. So this kind of the motion you can see here, this motion help like that, you know. So when this muscle become weak, we have a probability or possibility of the osteoarthritis. So everybody doesn't have, you can assume everybody doesn't have a bad knee. Why? Because there are another factors like your body weight, how you are walking, you know, like how you are standing, your muscles are weak or not. That all factor affect on this problem, and because of that this knee problem happen. So try to figure it out with the one visual as we mentioned earlier. You can see here, this is our good knee joint at the age of the 20, 30, 35, 40. But when we do the you know, lot of movement, the beginning of the process happen, and the process beginning happen like that. It's a damaged cartilage. So you can see here, it's a beginning of the things, and gradually it damage our knee joint. So it's easy for you to understand how we can prevent it. I'll explain you in a videos how we can save it, or how we can you know, like prevent the surgery. So what we do the certain movement, like somebody is standing you know, climbing stairs, so many you can see here. When you climb the stair, your whole body weight goes on your knee, and because of that thing there is a possibility of your damaged knee. The another video you can see here, when somebody is coming down from a stair in your house, you can imagine in Nairobi, when you have a two floor houses, you stair climb coming down back. So because of that your whole weight is going on your knee, and because this is the main cause of your problem. This is how your knee damage. So now it's time to understand. There are a few people, they have a problem of the ACL tear. So ACL tear, we don't have to do surgery each and every time. And I know in Nairobi I saw so many people, they have kids who are playing a sports, they have the bad ACL or ACL tear, and they've been suggested for surgery. So our goal is to educate all of you guys that ACL tear, you don't need a surgery every time. You can see in this video, when we do certain movements, like you can see here, when any force come to your knee, because of that your ACL damage. In video it's easy for you to understand how the ACL damage. So our goal is how we can figure it out. Does this ACL, means anterior cruciate ligament, require surgery or not? Let's try to figure it out. So there is a 4 type of the ACL tear. The number 1, it's a grade 1 tear. Number 2, grade 2, grade 3 and complete tear. If somebody has a complete tear, then and then it is a possible of surgery. But I'm assure you guys that 1, 2 and 3 grade, it doesn't require surgery. So here is the thing, my goal is to understand you guys, because in Kenya, or I would say in Nairobi, you have a very good country, like Nairobi is a very good city, but the medical is not I would say that much level based you can get in your city. So our goal is to educate you guys what to do, how to do, and when to do. So here is the thing, ladies, they are who are suffering more from the knee pain. You can see in video when you make your movement like knee bending or knee straight. Because of that, your patella is a top bone of your knee joint that has an inflammation, and because of the inflammation, you have a knee pain. It's a very common problem, age between 25 to 40. So the ladies who are young, who are doing a sports activity, kind of aerobic, Zumba, they have a very common knee problem, and you can see on the backside why it happens. It happens due to the improper weight bearing. I would like to say there are certain kind of the thing, it is called Patellar Tendonitis, and it is also very common. When you get up from a bed, the weight goes on your below the patella. So it's the top bone is called patella, and because of that you can see here some of the fiber damage, and because of that inflammation happens. So I can assure you this is advanced medical, this is a highly advanced medical, but it is not available in Nairobi till today. So our first slide is to indicate how keen we are in our diagnostic. Along with that, there are few housewife or working women, they have a backside of the knee pain. So why this backside of the knee pain happens? So it's easy to understand. You can see on the back side, you can see a fluffy part, or it's like a ball kind of the structure. You can call it swelling. How it happens and why it happens, let's try to figure it out through the video. Because of the heavy weight on the back side of the knee, you can see a little bit bulge comes out, and that bulge, it is an inflammation. And due to that inflammation, the backside of the knee has a problem. You can see here the red portion, it is a problem. Why it happens? Because of your body weight. So the ladies who has to sit for a long time on a ground, please try to avoid it if you have this kind of the pain. And you can figure it out, this kind of the pain, through, I would say, like a sonography or MRI. But the main thing, how we figure it out, we have a good knee or a bad knee. You can see here the X-ray. My goal is not to explain you how it happens. My goal is to even understand you guys how the knee, you can figure it out by looking at your X-ray. Is it a good knee or it is a bad knee? So you can see here, so there is a space in between two joints. This is called a good knee. So good knee has a very good space in between the joint. But here is a thing, once the joint is good, but what about the damaged knee or osteoarthritis or somebody who been suggested for a surgery? We can see here how the bad knee look like in an X-ray. So in a X-ray, you can see this is the bad knee. You can see that there is a two joint comes together, and that is called a bad knee. So it's very much like that. You can see here the two joints fuse or two joints comes together. If somebody has this kind of the X-ray, you can figure it out, you have a bad knee. But along with that, we have to figure it out, does this require a surgery? My friends, I would like to inform you, now the medical is so much advanced that every knee pain or every osteoarthritis doesn't require a surgery. You can 100% prevent your surgery. How and why, I'll explain you in a videos. But the three main thing required for the surgery, if you can't get up from your bed and go to the bathroom or a washroom, you have a very bad knee. Probably that time you need a surgery. Number two, if you have a severe pain, burning in your knee at a night, you can't sleep even. So then and then you required a surgery. Number 3, you know, like if some treatment from the outside doesn't work, then and then you require surgery, but make sure every knee pain doesn't require a surgery. We have now very much advanced technology and it is effective more than 93% to avoid, to prevent the surgery. Friends, you can see here in the pictures, that's a bad knee. So it's a very much common. You see there so many people, they are walking with the bad knee. So how the bad knee looks bad, and they have a very much difficulty in walking. But I would like to say it, you see this kind of the knee, this is bow legs, it's a band knee. So our goal is to understand you guys how it happens, how we can prevent it. That's how we can prevent the surgery. So I have one more picture for you guys to understand how we can prevent the surgery. So this is easy for you to understand. You can see the green portion here, that is a bone. So green portion, it is surrounded by the muscles, and that muscles, if you can, you know, stronger that muscle, 110% we can save your knee surgery, because muscles, you can see, it's a very much a portion of the body, and the bone is very tiny. It's just a weight bearing procedure. So here is the thing. I got some x-rays, the patient what we are treating. So you can see here, we have some x-rays with the patient. This was a bad knee. When we started the treatment, it was a bad knee. The two joints comes together, but after a 6 month of proper exercise, you can see here, it's a very good joint space, you can see here. So we can definitely treat you from here and make you like here, and we can avoid your surgery. You can see here, there is a very good knee joint. It is all possible. How? Let's say this is the pen, and it's a 2 finger. The pen is your bone, fingers are your muscle. If your muscle weak, pen drops, and that's what happened here. You can see clearly in x-ray. This is a thing. When we started, it was a bad knee, but once we strengthen the muscle like a fingers, then definitely we can see a good knee joint. Here is the thing, some people are thinking the surgery is a good option, let's go for a surgery. But friends, I'll try to show you certain data. Surgery, the knee joint, once you do the surgery, it even work for a prolonged time, because you can see here in a picture, sometime what happened after the surgery, you can see the joint again, you know, like comes together, and again it's a mass. So artificial, this is called artificial knee joint. You can see after a certain period of the time, the 2 knee joint which been operated, which has been like, this is a total knee replacement, has comes together. So then it's a mass. So our goal is to help you guys and avoid maximum surgeries as much as we can. Why it happens, it's a main thing. Let's try to figure it out through this picture. When we sit on the floor, you know, so when we get up from a floor, we don't take a weight on our hands, and that's a major cause. So here is a thing, you can see here in this picture, the lady sit on the floor, get up from the floor, doesn't take a hand weight. It's a big mass, because when we sit on the floor, get up from the floor, we take 8 times weight on our knees. Let's say if our weight is 70 kg, 70 into 7, it's a 490 kg. So we take 245 kg on a right, 245 on a left. So that is the cause of this knee problem. My friends, I'll give you one suggestion. When you sit on the floor, when you get up from a floor, try to use your hands, so your knee can be saved. So one more thing, if we can use a chair, so the base thing is chair. So if we can use a chair, this is a base thing, and we can definitely we can prevent it. You can see here, so we can definitely prevent this thing from getting our knee worse. So our goal is to, you know, like understand, if you like in a previous picture you saw, if you sit without like a support, then your knee can be bad, but if you can use a chair, your knee can be saved. So there are a number of people, you know, like who has to stand, and particularly if I'm talking about the Nairobi, there are a number of people who have to stand for a prolonged time. So we can say it, so many girls has to wear the heels, and this is the one of the things, it really damage your knee and your back. So that's why I like to show you one picture. It is called, it's all connected. So when you hear the heels, from your heels to your back, look at your angle of your knee and your back. One each heel can give you, there is a 22% possibility your knee can be damaged or your back can be damaged. Make sure this thing, because I saw so many people over there, they are using high heels and heels. 2 each heel can give you a 57% of possibility of pain, and 3 each heel can give you a 76% of possibility. So I am pretty sure this all you are not aware of this thing, and because of that your lifestyle making your knee, your back or your neck worst. I would say it's a posture. So this is the posture we have to align. If we can align this posture, definitely we can prevent knee pain, back pain, even we can prevent the neck pain. So why it happens? We try to figure it out through a picture. It is called fit, because so many people, I would say out of 100, 60 to 65% of the people have a bad fit. It is called a flat feet. So flat feet, it is something when you put your feet, it's a completely flat. So our goal is to, you know, like try to understand how we can prevent the flat feet. So you can see in certain pictures, I think there is something error with the broadcast. So that picture is quite delay, but I'll try and to coordinate with the pictures. This is, we can see it's a healthy feet. You can see here, friends, this is called healthy feet, and this is a flat feet. So our goal is to figure it out how if somebody has a flat feet, they have a very much possibility of a knee pain or back pain. So try to figure it out how the flat feet look like. So you can figure it out at your home. Look at the picture, you can figure it out. This is a flat feet. This is this kind of the feet always gives you a trouble. So friends, if you have, or your family or your kids have a flat feet, you need to immediately take care of your things, otherwise it gonna damage your knee and back. Along with that, we can figure it out. There are a number of people, when they walk, they don't figure it out how to walk. They don't know even how to walk, because nobody in our school taught us how to walk. So I'll try to explain you through the pictures how we have to walk and how the weight goes. Look at this line. So hip, knee, ankle line. So somebody has a when you walk, you have to walk heel to toe. Make sure if you walk heel to toe, you will win the game according to me, because your knee, your hip, your knee and your ankle, that are the pillars. If you walk in the wrong style, definitely you had a back pain, chances of the back pain, and it gonna damage you a lot. So if somebody has a flat feet, what you can do is you have to wear the insole. I would like to show one pictures. It's easy for you to understand. Thing when it is a bad posture, we can figure it out. See, this is we call arch drop. So it's due to this arch drop. It rotate your knee and it rotate ultimately your hip. So because of that, we can see here easily. Here is a balanced posture. You can see here it's an imbalanced posture, and imbalance and balance, it's easy that because of the imbalance, your back, your hip and your knee, it's damaged. But when it balance due to the proper insole, you can see all thing is proper way. Now go for the another thing. Here how we can walk. We can walk like that. Because of the bad posture, it affect up to your neck. You can see the red line goes from all the way to your leg, and because of that flat feet, you can see the problem. But if we can correct the both of the feet, we can definitely correct the whole posture, and we can prevent the pain. So the most important thing is your footwear. Once you have a good footwear, definitely we can prevent all of these things. I'll try to things you can take this kind, use this kind of the footwear. It has a good outer sole and insole. If you have the foot with the good insole and outer sole, definitely we can prevent the knee pain and back pain. And the most important thing, even though people don't know how much to walk a day, so every day if we can walk 10,000 steps, so it's easy for you to understand. 8,000 to 10,000 steps, it's a normal step you have to walk every day, because that's how we can figure it out. Your knee is walking properly. And the main thing, when anybody has a knee pain, here is a thing we have to figure it out. When anybody has a knee pain, what to do? A cold treatment or a hot treatment? So the most important thing, it is a cold or hot treatment. Friend, you have to understand, because there are lots of myths about cold and hot treatment, because some doctors advising you for the hot treatment, some advising for the cold treatment, and people are real confusing what to do, and some are advising both treatment. Let's try to figure it out what to do and what is effective for you. You can see here, when any kind of the pain or inflammation in a body, there is a vasodilatation. So this is in your arteries, you can see the blood flow can move like that. This is called a normal blood flow. But what happens when you apply ice pack, because it do the vasoconstriction? Because of ice pack, you can see the blood flow, arteries are narrowing. So this is the most important thing. That's why you have to do a cold pack. And when you do the hot pack, you can see the vasodilatation, the flow is like that. So when you have any kind of the inflammation, friends, make sure do not use a hot treatment, because it will ultimately going to damage your problem. So you can see here in a sportsmen, when they have an injury in the football game, they apply the cold pack. They never apply the hot pack. You can see here they apply the cold pack like that. You can see somebody is playing a game with the ice pack on a knee. Most important thing, people majorly apply the hot pack, and sometimes they feel good but they don't cure. So this is a thing, if you apply the ice pack in a proper manner, I would say definitely you can get the result. But most important thing, how to apply, how many times a day? So 10 minutes a day. Most important thing, I would say 10 minutes you have to apply the ice pack for 3 times a day. Make sure 3 times a day. It will definitely help to reduce your pain and swelling in your body. So I'll go further. This is the way how you can apply. You have to put the ice pack. On top of that, you have to apply the towel. So that towel will help you. So don't your cold will not go in the environment. So one more thing, cycling. Cycling is a most important thing, because so many people are walking a lot. So don't walk for 1 hour, 1.5 hour. Instead of that, every day do like at least 20 minutes of cycling, because that cycling will make your muscle good. I'll try to explain you with the our technology, because it's easy for you to understand. When this is the main muscle, when you walk for a longer time, let's say if you walk like that for a prolonged time, you are taking weight on your knee. You can see here every weight is going on your knee, and because of that, it is a possibility that your knee is going to damage. And you can see when you walk, you get hardly 20 to 30 degree movement. But in a cycling, you do like that, knee flexion, extension. This movement basically strengthen your muscles. One more movement. This is like hip flexion and extension. Friends, you can see here this all two combination of the movement try to help you to strengthen your muscles. So for you guys, it's you have to keep in mind maximum use a cycling. Let's talk about the spine, because so many people are suffering from the back pain, sciatica, L4-5 problem. So my goal is to even help you guys to understand why spine problem happens, how we can treat it without surgery. No surgery required, I can assure you. But how? So here is the thing. This is our spine, and this is basically our L1, L2, L3, L4 and L5. You can see in between there is a white portion. The white portion, it is your disc. So when the problem happen in the disc, and this is called the disc herniation, or I would say it is called lumbar spondylitis. Let's try to figure it out how it happens and why it happens. We are going to the spine portion. Look friends, you can see here, this is our L4 spine and this is our L5 spine. On between of that, this is a disc. Friends, you can see here, this is a disc. I can assure you, you never saw the disc, because this is the disc. You can see a lot of doctors are doing MRI, X-ray, CT scan, and they say your disc has a problem. But let's try to figure it out exactly how it happens. This is the disc. The green portion is a fiber, and the white portion, it's a nucleus. It's a gel kind of structure. When the pressure comes L4 and L5, the disc comes out, and it comes out in this portion. You can see a hollow space here, and when the disc come out in hollow space, the pain start from there, and this is actually like that. Because of that, you can see here friends, this nerve goes down all the way in your leg. So the pain goes like that in your leg. So this is called a sciatica. So start from your back. You can see here, from here, your buttock, your back of the thigh and your calf muscle. So this is basically a sciatica. Friends, you can see the clear pictures how it happens and how we can figure it out. But on top of that, I'd like you to show one video so it's easy for you to even understand. Look at the spine. The blue color, it's a nucleus, it's a gel kind of structure, and surround that it's a fiber. When the blue color comes out, it compresses yellow portion, that is your nerves, and this is called a pinch nerve. Basically, because of that, your pain starts from your back, goes all the way down in your leg. This is called sciatica. This is how the problem happened. I would like you to try to understand. Look, this is the red thing, and the red thing comes out. It is called a pinch nerve, and because of that, the problem start. It is happened due to your weak muscle. You can see here, this is a muscle spasm, and because of that, the whole problem start. But I would try to figure it out. One more thing, why it happens? Because every day we lift the weight. You can see here friends, when you lift your weight, or when you do any kind of the movement, so because of this movement, jerk goes in your back, and that's how it happens. That's how the disc problem happens. That's how the L4-5 disc herniation happens. So the main thing is your red thing. This is called your muscle. When the muscle has a spasm, weight goes on your spine and everything happens. So the most important thing is your posture. You can see here the first picture, kids when they play games, or even though sometimes you sit like that. This is a very wrong posture, and because of that, this disc problem happens. Friends, try to understand why it happens. The second thing is even a wrong posture, but third one, you can see here, it's called a 90-90 posture. If you can sit like that, like the third thing, this is the position where you have to sit a maximum. So this is called a 90-90 posture. It is a correct posture. If you sit like that maximum time, I can assure you guys, you can avoid your back problem. So lifting the weight, you can see the first thing, when you have to lift a heavy weight, don't bend forward like that, because if you bend forward like that, it definitely affect your L4-5. The correct posture is like that. I'll try to explain you through the video so it's easy for you guys to understand. When we lift weight, what happened? you can see here this spine is connected by the muscles like that. So this is a paraspinal muscle. When you lift the weight like that, it hurts your spine. You can see here, friends, look, when you bend forward, you can see clearly your L5S1 has a compressed disc, and because of that whole sciatica happens. Friends, you have to understand, so don't bend forward while lifting weight, never do it, otherwise you will gonna damage your spine. L4-5 problem happens. So when you have to lift the weight, you have to bend through your knees and then get up. Most important thing, bend your knees and then get up. So here is the thing, I have one clear research based data. If you don't sit properly, you have 63% possibility of low back pain, 38% possibility of the shoulder, 53% of neck pain, and 33% of your wrist pain. But major, it's your back pain. Make sure, friends, you sit properly. But one more thing, there are number of people who are suffering from not a sciatica but similar kind of the thing, that is called a piriformis syndrome. Friends, you can see here, this is the muscle name, it's a piriformis. When this muscle has a problem, the yellow thing, it is called a sciatic nerve, and because of the sciatic nerve, the problem goes down. Let's try to figure it out through the 4D medical. Here is the thing. You can see here, this is the piriformis muscle, and when this muscle has an inflammation, because of this inflammation, it goes down, through which pain goes down. Friends, I can assure you a number of people has this kind of the problem where they are considering as a back pain. Trust me, this is not a back pain. Your pain is on a buttock portion. So if you can press on your buttock portion here, if you have pain on this portion, then you have a piriformis syndrome. This is the thing, this is the diagnosis. Even you can search on the Google, you can find a lot of things. But my goal is to help you guys to understand the problem easily. Pain start from here, goes all the way down like that. So what to do, how to do, and how we can treat this problem. So main symptom, it's on your buttock portion. You can see the two axes, and the red portion, the pain start from the red thing, goes all the way down. So why it happens? Most of the people put the wallet on the back side, on the on a buttock portion. Don't put wallet like that, because this will make your piriformis syndrome. And this is the thing. That's how you can, because of the wallet, this is another name is a wallet syndrome. Because of the wallet, pain start from your buttock, goes all the way down in your leg. This is the piriformis syndrome. And what we do, we go and do the MRI all the time, but we are not solving the problem. So my goal is to help you guys understand MRI. It's not a solution, it's a diagnosis thing. Let's try to figure it out. Look, this is your X-ray. Like this is anybody's X-ray of the spine. You can see here there is a space in between two spine, but you can't see that disc in an X-ray. Let's try to figure it out. What we can't see in an X-ray. Here is a thing, friends. This is your disc. The green thing is your disc. But this disc we can't see in an X-ray. I'll jump back to the photo again. But so what we can see? We can see this is an MRI picture. You can see the red portion here. That black part is coming out. This is actually a problem. The B image, you can see that this red arrow marking this black spot coming out. That is called a disc comes out. Disc herniation, disc problem. So our goal is to understand you guys. If it happens, MRI is not a solution all the time. You have to fix it, and how we can help you to fix that thing. Because what happening, you can see this thing. Sometimes you can see this sea green thing. You took the MRI of your back, and the problem is on your piriformis. We can't take this thing in MRI. So friends, try to figure it out. Every time MRI can't help you because of this thing. And I'll give you one solution. You can even figure it out. If somebody has a problem on first and two fingers, like tingling and numbness, like that, this is L4 problem. If somebody has a problem on the first toe, like they have a burning, tingling, numbness, this is the L4 problem. The second, third and fourth finger, it's a L5 problem. If somebody has a sole of the feet problem, it is a L5 problem. I can assure you this is a transparent medical. So what I am doing, I'll try to show you whatever exactly and how the problem happened. You can see the L4, L5, this dark purple and the light purple area goes all the way down like that. So anybody, I would say anybody even in Kenya or Nairobi, they are suffering from this kind of the problem. You have a L4-5 problem. So let's go further. Somebody has a certain areas, they have a spine problem, like the spine has actually comes out from the alignment. You can see here the alignment is bad. This is called you can see in x-ray, this is a bad alignment. How it happens, let's try to figure it out. Because your spine is connected to the brain. Sometimes people feel because of the disc problem they got a paraplegia, friends, or they have a paralysis. Friends, trust me, it is not a paralysis. It's just a temporary thing. So take, like something seriously. If you have a disc problem, you have a paralysis. It never happens. It never happens. It only happens when you have a certain kind of the thing. When there is a fracture of the spine. You can see here, if somebody has a fracture of the spine, then you can see the blue portion, that is a paralysis. So until and unless you don't have a fracture, don't worry, you never get a paralysis. Lifestyle that affect the lower back pain, most important thing. Why it happens? It happens due to the smoking, due to the heavy weight and lack of the physical exercise. So I have 7 recommended lifestyle changes to reduce the lower back pain. Friends, you can see here, prevent heavy lifting. You don't have a lift the heavy weight. Prevent long period of the sitting. Every half an hour, get up from your chair, walk for 2-3 minutes and then sit on the chair. Avoid smoking. Prevent bad posture. Most important thing, prevent bad posture. Discover your best sleeping position. It's most important thing. I'll show you in through the pictures how to sleep. Add more exercise. Consume healthy diet. So when you have a back pain, do one thing. You have to apply the ice pack. I already mentioned earlier, when anybody has a back pain, L4-5 problem, you have to apply ice pack like that. I'll show you one more time. You have to put ice pack here, then one is here on this portion and this portion. So all these 4 spots you have to apply ice pack for I would say like 10 minutes each spot, and 2 to 3 times a day, not more than that. Okay, so after the ice pack, what you have to, some people are taking painkiller, but the painkillers itself say it's a painkiller, not a pathology killer. So if you really want to treat yourself, don't take painkiller too much, because it's only a temporary relief. Somebody thought of surgery, but surgery, I would say it's really a dangerous thing, because I'll try to explain you how many nerves come out from your spine. You can see in L4-5, this is basically our picture. Look, you can see this is a very complex network of our spine. So that is why surgery is not recommended. Even no doctors will take guarantee anywhere in the world. Why? Reason is that because of the complexity of the network. First, try to fix without operating, or without surgery. So our technology helped to reduce the pain from here. Our laser technology helped to reduce the pain, like inflammation of the disc. We can fix it, this inflammation, so automatically your pain will subside, and you have to do a certain exercise and you can be fit forever. Along with that, sleeping position. Some people, when they sleep on one side, make sure you have to put a pillow, your leg on a pillow. So that's why you can avoid stress on your back. The most important thing, when you sleep on a straight line, keep a pillow below your knee, because knee, if you can keep sleep without pillow, the maximum load goes on your back. So keep a pillow below your knees. First, try to avoid sleep on your belly or on your stomach. But if you want to sleep on your belly, then keep a pillow on your hip portion, not on a back portion, on a hip portion, because that will avoid stress on L4-5. and try to avoid this kind of the food at night, alcohol, or I would say beer, non-vegetarian food or coffee, because this is a food that makes your stomach upset, and because of indigestion your back pain can be aggravated. And don't sleep like that. This is the most important thing. Never sleep like that, because it will ultimately damage your spine. Friends, I can show you some videos we've been tweeted in India. You can see here the patient walking like that. He has a very much difficulty in walking. This is the first day position. When patient came to our office, he has a very much difficulty. But with our cold laser and nano current technology, you can see after like 7 to 10 days, patient is walking in this condition, and after like 12 days, patient walk very well. You can see here the maximum problem is resolved. But after like 15 days, the problem is completely resolved. We can do it. We can definitely fix it by our cold laser and nano current technology. You can see the patient is walking absolutely normal. So our goal is to educate you guys. Anybody has a back pain, they don't have to walk more than 30 minutes. Then a herbal tea, or I would say green tea, that help you a lot to reduce the back pain. You have to figure it out what kind of the activities give you a pain. Like, let's say somebody has a pain through the jogging, somebody has a pain through the swimming. Don't do it. Please don't do it. When you have a pain, never do any kind of activities. Somebody has a tingling, numbness, burning on a feet. This is due to, I already mentioned earlier, it's a L4-5 problem. Because of that, you are getting this kind of the sensation. Friends, if you have this kind of the things, try to consult a pain management doctor. You can consult our team in Nairobi, Kenya. So they will they are expert to treat you, reduce your pain. Also, they will explain you exercise you have to do every day, and it will help you to recover from the things. Most important thing, why it happens. This is the thing what you have to learn. It happens due to the bad posture. Because in routine life, most of the people do error. They don't take care of the posture. So this is a good posture, but we see the people standing like that, first, second, third and fourth. You can definitely go in front of mirror and check your posture. Which kind of posture you have, first, second, third, fourth or fifth. If you have a fifth posture, it is a good posture. Then definitely you don't have to worry, because if you have this posture, then you are very much in a good shape. You don't have to worry about anything. But still, still you have to take care that you don't go in any of these four posture. So we have a certain kind of the exercise for a sciatica. For this kind of the exercise, what you have to do at your home, you can visit our YouTube page. It is Aalayam Rehab Care. So you can get this all exercise you can do at your home. So already we have treated 52,000 patients in India, and it is more than 24,000 in arthritis, 18,000 in sciatica, and 10,000 frozen shoulders. So we are expert in this kind of the treatment. So our technology, how it works, it gives you the result like 30% of reduction in pain within 5 to 7 days, and 70% in just 10 to 12 days. So our team are very much expert for the making your exercise program. So they will help you to do the exercise regularly, even though they will make a program for you for the exercise for a lifetime. And our technology, that is called e-laser calmative, it doesn't have a zero side effect. So it's a no side effect. The most important thing, it's a safe and alternative method to the surgery, and it's a patented technology. I would say how it works. Let's try to figure it out how it works. When we apply the laser on your body, the laser penetrate in your body. It's a very safe technology, and when it goes in a body, you can see the cell movements in body. So when there is an inflammation, you can see there is a lack of the blood supply on a particular aspect, whether in a back, whether in a knee, or anywhere in a shoulder. So that laser help to activate this cell. This is called a cellular repair and healing process. It's a completely a natural process. You can see this is a mitochondria. So when the laser goes in your body, it activates the mitochondria and it helps to secrete the nitric oxide. Nitric oxide is a main component. Along with that, it will create ATP. ATP is adenosine triphosphate. So this ATP and the nitric oxide, it's a key thing to reduce the inflammation, because friends, painkiller doesn't do this kind of the activity. This is a local treatment. So you can see here, nitric oxide is a very powerful vasodilatation, and it helps you to reduce the inflammation. So that's how your pain goes permanently from your body. And our goal is to promote the natural repair and healing process. When it happens, you can see here your pain goes for permanently. Along with that, you have to do the exercise regularly to prevent further damage. Exercise is must. I would say anybody has to, to live a good and healthy lifestyle. Do exercise regularly. You can see once you do that thing, it automatically resolve your problem, and it is effective 93.7%. And we have so many reviews on a Google and Facebook. Friends, to Nairobi and Kenya, we are starting our Aalayam Rehab Care clinic on a second Parkland area in Nairobi. I know it is a very famous area. It's nearer to the lot of Indian community. So please note our numbers. Right now we are doing a free consultation in Nairobi, Kenya. Anybody has any kind of the pain, or your friends or your family who stay in Nairobi, they want to consult our team, our doctors is available there from tomorrow. This is our botline number. It's a 254-110-00-5562. You can call, you can go and check yourself. You have any kind of the pain, so our team will help you out. Basically in India we have more than 160 doctors are working. Friends, if you like our video, what we are doing right now, we are trying to educate the people how the pain happens. Please share on Facebook, like it. So we'll come with the more Facebook live for you guys. Make sure in this COVID-19, take care of yourself, your family. Thank you so much.